Okay. Sir. Na.
Like.
Na. Okay. The next is you're going to perform manual compression test. So, karon sir, I'm going to perform compression manual test. So, okay. The next is you're going to perform the Trendelenburg test. So, Trendelenburg test investigates the stability of the hip and particularly the ability of the hip abductors and to stabilize the pelvis on the femur. So, karon sir, I want you to stand, sir. Sige, sir, stand. Tapos, I want you to raise your left leg, sir. Tapos, imo lang siya iana, sir. Imo siyang i-hold. Sige, i-bend. Ayan, naguniti. Ano lang. Okay. Sige, sir, your other leg. Okay. Okay, sir, sit down. Sit down na, sir. So moving on to the musculoskeletal system. So first is you're going to assess the patient's gait. So the patient to determine. So this is to determine if the client can distribute weight evenly. The client is able to stand on heels and toes. The toes point straight ahead. Equal on both sides are the normal findings. And also posterior erect. Movements coordinated and rhythmic. Arm swing in opposition and stride length appropriate are also the normal findings. So, karon sir, I want you to walk, sir. So, sige sir, di lang katamon sir, tapos balik lang kayo kadri ha. Normal walking lang sir ha. Sige sir, go. Pati ang swing sa kamot sir, pati ang swing sa pagkamot isabay. Okay, sige. Sige, go. Sige, pabalik. Sige sir, balik po sir. Balik. Okay, thank you sir. Sige sir, sit down na. So moving on to the upper extremities, first is you're going to inspect and palpate and test range of movement of the TMG or the temporomandibular joint. So snapping and clicking may be felt and heard in the normal client, and the jaw has full range of movement, range of motion against resistance. So contraction palpated with no pain or spasms are normal findings. So now, sir, I'm going to inspect and palpate your TMG. So, sige sir, di lang sir. So, kanay sir, mo ni imong jawline kanay sir, jaw. So, ako ipalpate. Now, I want you to open your mouth, sir. Close. Open. Close. Okay. Okay. Next is you're going to inspect, palpate, and test range of motion of the sternoclavicular joint. So the normal findings is that there is no visible bony overgrowth, swelling or redness. Joint is non-tender. So in this, sir, I want you to take off your clothes, sir. Okay. So I'm going to check your sternoclavicular joint. Yes, sir. So connected siya. There are no redness or swelling. Okay. So I want you to move your hands, sir. Okay, pataas. Happy ka, sir. Okay. So now, sir, I'm going to, next is you're going to inspect, palpate, and test range of motion of the cervical spine. So now, sir, I'm going to check your cervical spine, sir. So I want you to look this way, sir. Look this way. Sir, ano, sir. So I'm going to check your cervical spine. Okay, relax lang, sir. Ano, sir. Chest out. Okay. So I'm noting or looking for any tenderness. Now I want you, sir, to look the right way. Tanaw ka sa right nimo, sir. So dito. Okay. Balik. Ano po sa left. Okay. Balik. Then I want you to hyperextend your head. Like that. Balik. Then I want you to your chin to touch this part, sir. So iubos, sir. Bend. Okay. Balik. Sige, bend, sir. Balik. Oto, sir. Paubos, dire. Okay, very good. Thank you, sir. So next is you're going to inspect, palpate, and test for range of motion of the thoracic spine. So now, sir, I want you to stand, sir. We're going to test your thoracic spine. So talikod, sir. Okay, I'm going to palpate. So I'm looking for any tenderness, sir. So I want you to bend, sir, to the right, sir. Pinaana, sir. Bend. Sige, balik. Then sa left. Okay, balik. Then I want you to bend over, sir, dito sa front. Okay. Tapos iubos ang kamot. Okay, balik. Tapos i-hyperextend rin, sir, palikod. Okay, balik. Again, sir. Sige, sir, sa front. Okay, balik. Then sa left. Sa left, sir. Okay, balik. Right. Okay, very good. Okay, sit down, sir. Thank you, sir. Next is you're going to inspect, palpate, and test for range of motion of the lumbar spine. So I want you to stand again, sir. Tapos I'm going to test or inspect and palpate your lumbar spine. So I want you to bend over, sir. Tapos murag gyapon pero i-extend jud siya paubos. Sige, ano? Balik. Okay. Then to the right. Okay, balik. the left. Okay, balik. Then paatras diri sir, hyperextend. Okay, balik. Okay, thank you sir. Then next is you're going to inspect, palpate, and test range of motion of the shoulders. So the normal findings are shoulders are symmetrically round, no redness, swelling, or deformity or heat. So next sir is I'm going to test your shoulders. I'm going to inspect your shoulders. So now sir, I want you to sit down in this sir. Good to sir, dribble in sir. Good. Dito ka ito lang natin. Okay. Okay. So I want you to move your arm sir pataas. Okay. I-straight lang siya sir. Yan na lang siya. Okay, go. Tapos. Tapos sa pika sir. Now sir, sige, taas. Ubos. Hinay lang sir, slowly, taas. Ubos. Okay. Tapos isabay sir, taas. Ubos. Okay. Thank you sir. So next is you're going to inspect, palpate, and test the range of motion of the arms. So inspect the forearms, elbows, and upper arms for size, shape, and symmetry. And you're going to note obvious muscle atrophy or fasciculation, fasciculation, involuntary movements, or abnormalities of position. So I want you to extend your arm, sir, so that we can check your arm. I-bend sir, gamay sir. Then I want you to extend your arm sir, pataas. Slowly. Di pa ubos. Just. Extend your arm sir. Ubos. Okay, I'm going to inspect your arm, sir. Okay. Next is you're going to inspect, palpate, and test range of motion of the elbows. So elbows are symmetric without deformities, redness, or swelling are the normal findings. So I'm going to check your elbow, sir. Okay, sa pika, sir. Okay. Then I want you to isundog ako, sir. Ana, sir. Tapos paubos. Okay, ana, sir. Direct extend dito sa taas. Dito taas. Then paubos.